Greetings, everyone. Thank you so much for attending the Global Health Action's Risk Communication and Community Engagement COVID-19 webinar. Our guest today is Melinda Frost, who serves as the Risk Communication and Community Engagement focal point for the COVID-19 response at the World Health Organization. Prior to the COVID-19 response, Melinda led RCCE capacity building for WHO under the Pandemic Influenza Preparedness Framework. She's held this position since January 2019. She's directly helped more than 40 countries build their emergency risk communication, preparedness, and response capabilities under the international health regulations. She also helped design the WHO European Region's Emergency Risk Communication 5, the 5-step capacity building package, and is currently finalizing the globalized version titled The Fundamentals of Emergency Risk Communication and Community Engagement Package. My name is Jenelle Williams, and I'll serve as your moderator. Thank you so much, Melinda. Welcome to our space.
Thanks for having me. So today I'd like to talk a little bit about the way WHO has in the past conducted risk communication and community engagement work with our member states and localities, and also to talk about how we've slightly changed our response for the COVID-19 pandemic. Next. So for this pandemic, we've actually started something a little different in our approach around communications during an emergency. We have a whole pillar called Infodemic Management. We like to say that at WHO, while our colleagues are fighting the epidemics or pandemics, we in communications are fighting the infodemic. And the infodemic is such a huge amount of information, both truthful and sometimes not truthful, that it's making it difficult for individuals and decision makers. And decision makers might be politicians, or they might be mayors of towns or community leaders, or they might be a parent. And these decision makers can't find the information that they need to answer their questions when they need to. So what WHO is trying to do is to fight that infodemic and get information to the right people at the right time to allow them to make the right decisions for themselves and their families and their communities. Next slide. So the principle behind this is so that individuals and communities can better protect themselves by having access to timely information that's both relevant and credible from trusted resources during this pandemic. Next. So when we define emergency risk communication and community engagement at WHO, this is under the international health regulations. And the key important things that we're talking about is that it's real-time exchange of information between experts and those who need to, again, make decisions in their lives. And the goal here is that everybody who's at risk is able to take informed decisions to mitigate the effects of an emergency or hazard in their lives, in this case, COVID-19. Our approach is to use a mix of communication and engagement strategies, so not just mass communication, not just social media, but a variety of things, including health promotion, social mobilization, and community engagement. Next. This image was actually taken from some of our preparedness work. I think this was in Romania a few years ago. And the quote that came out of this preparedness workshop was that our emergency response can be incredible, but if we don't communicate well with our public, it'll all be in vain. Everything that our emergency responders will have been done for nothing if we can't include communication as part of our response. And to me, that just really said it right there. We have to really consider communication, emergency risk communication, and community engagement as an equal part of the response during emergencies, or in this case, the COVID-19 pandemic. Next slide. So the basic issue that we're facing every single day is uncertainty, right? There's a lot of uncertainty. Every day we're finding at WHO that we're learning something new about COVID-19, something we said or thought was sure the day before. The science changes, we learn more. So every day something's new and different. And it's difficult to impart sort of the the solid information or recommendations that we can give to individuals in communities, because every situation is quite different, and the situation is quite moving very quickly, and it's very dynamic. So there's a lot of uncertainty, and that's what causes people concern, right? It's you can kind of handle or deal with a bad situation if you kind of know what's going on or can understand the whole situation. But in this case, there's a lot of uncertainty. And so it really makes it difficult for leaders and countries and ministries of health to be able to communicate, because there's so many unknowns. Next slide. So the overarching goal behind emergency risk communication and outbreak communications is that we really want to always build and maintain or restore trust. This is the cornerstone of what we're trying to do when we communicate during public health emergencies, is to maintain that trust between experts, ministries of health in this case, and the population. If that trust doesn't exist, then individuals are not going to follow recommendations because they don't trust the individuals that are giving these recommendations. So it really is, it's critically important now more than ever. Okay, next slide. So what helps the population trust individuals that are running the operations? The population is often asking, are the individuals that are managing this emergency, are they skilled enough to be able to communicate well? Do they know what they're doing? They're also asking themselves, are they acting to safeguard my health? Do they care enough about me to be protecting me? Do they understand me? Do they know what my life is like? Do they know what my daily life is like? Do they know about my job, my home, my family, and so on? Do they know what I'm all about? And they're also wondering whether or not the managers for risks, emergencies, are actually telling the truth. Or are they telling the whole truth? Or are they omitting part of it? So these are some of the questions that are going on. Skills, motives, empathy, and honesty on the part of emergency response officers or managers, and probably politicians in this case, for the COVID-19 response. And if you can say yes to all of this, next slide, then you will have gained trust with your population. Next slide. So this one's kind of interesting. You can just kind of click through it a bit. So this shows an average Epi Curve. And if you pause right there, what often happens in many cases is that we have sort of delayed or ineffective response. So you can see the number of cases are under the curve there. And what sometimes happens during emergencies is we don't communicate until it's too late, or we don't target the right target audiences, and we don't get the right messaging out on time. So unfortunately, that gives us very little time, or this very little ability. This is sort of our opportunity for control. So we can't control the message. We can't control the public health recommendations unless we do this very quickly. So if you go to the next slide, you'll see that if we react very quickly with a timely response with communication, we have much more opportunity to potentially flatten the curve, as you're hearing a lot in the news. So it's important to continuously communicate and communicate quickly and early, especially now. So if we take it now for COVID-19 and think about where a pandemic was recognized and where maybe a vaccine might be introduced, we don't know that there will be a vaccine. It could be years away, and it might not come at all. Right now is this space where we really have to focus on communicating. These are things that are non-pharmaceutical interventions that we're talking about: hand hygiene, respiratory etiquette, potential use of face masks for those who need it, different things like surface and object cleaning, isolation of people who are sick, travel advice, and then work and school closures if needed. So these are some of the things we were even thinking about during a pandemic influenza. Now they're playing out during COVID-19. So this is right now, this is all we have, right? We just have these non-pharmaceutical interventions. So that means really all we have right now is communication to make sure that individuals understand the importance of that and can follow those recommendations, and that communities can adopt them in a way that makes sense for their situation. Slide. Yeah, and so right now it's important to just really be engaging with communities more than ever. So when we talk about, I'm going to go back to the idea quickly about infodemic management. And what we're saying right now is that we almost have infodemic tsunami, right? There's so much information about COVID-19 coming from all different directions, social media, mass media, and so on, that is really difficult to kind of cut through the noise. So at WHO, we've been kind of addressing this a couple different ways. We've been doing a lot of myth busting because there are lots of myths out there. We're really trying to simplify the science, and then we're trying to amplify the science and scientific messaging through amplifier networks. And I'll explain that in just a minute. Next slide. So the way we kind of choose the topics and the things we're going to focus on are a couple different ways at WHO. We have regular ongoing technical updates, our guidance documents that are coming out every single day. So we have to stay on, that's our way of sort of staying on top of the science and our recommendations. And then we're doing things like conducting media measurements and behavioral insight measurements so that we can kind of determine what the key questions and concerns are and can address those. And then also we're getting a lot of information from our regional and country offices that help us better identify sort of rumor monitoring and have a certain amount of metrics around those as well. Next slide. Okay, so I think I touched on this. These are sort of our technical guidance that, I mean, you can see them here, right? They're 12-point type times New Roman. So they need to be simplified for people to understand and really be able to follow what the recommendations are. Okay, next slide. Okay, and this is sort of some of the media measurements that we're taking in behavioral insights every week so we can identify what the key concerns are again. So we run media measurements where we're looking at mass and social media right now currently in English, but we're broadening it to French and other languages soon. And then also taking a behavioral insights survey that goes to about 30 to 60 countries, depending on the survey. And we get the key concerns and questions every week. And then we also scan WHO social media to see what the trends and the questions are there as well. Next slide. And this is just a quick overview from a couple weeks ago that shows the top topics of volume for mass and social media and helps us better address, again, what the myths are, what the underlying concerns are, and where the questions are, so we can better target our communication on a global scale. And then what happens is we design our information and then it gets taken by our regional offices who then sort of adapt it for regional purposes and of course then translate it and so on. So that's sort of the trickle down way it works at WHO. Next slide. This is just a bit more detail that shows us where the rising issues are. They go by number of mentions for certain things. In this particular case, they were talking a lot about different symptoms, and so there was some confusion around the symptoms that were occurring in the news. So we addressed it by providing updated information on the symptoms. And also around this time, there was a lot of question around the immunity for COVID-19. So again, it just gives us a bit of an advanced look at the types of information we need to be able to disseminate about this. And then also you can see there's an increase in questions about vaccines. So now we, of course, at this point in time when you see this, it'll be long gone, but are really working hard on our vaccine communications plan. Okay, next slide. Yeah, and then again, just simplification of the science and the constantly changing science and trying to be very clear about why information is changing and then getting regular updates. So you can see that we have on the right-hand side a bunch of mythbusters that we regularly send out and they're dated, right? Because that information is could likely change in the future. And then of course, different information that gets translated at the regional or country level as well. Next slide. And then earlier I mentioned that we are doing a lot to amplify our information. So it's not just on social media or mass media or the website. What we're really trying to do is target information through specific amplifier networks that WHO is working with. So we have amplifier networks with the healthcare industry, travel and tourism, employers, the business sector, faith-based organizations, and also we're doing a lot with the young adult groups as well.
Mm.
So here we're working closely with these groups to find out the type of information they need and the way they need it so that they can best amplify that information to their constituents. So this means, this better ensures that there's going to be a trusted pipeline of information going to these individuals, right? Because the network's already there. So we're just borrowing trusted networks that already exist. Okay, and next slide. And this is just an example of the work that we've been doing with our faith-based organizations and providing very timely guidance on how to have safe faith practices, either in person or at a distance. And we worked really hard with representatives from different faith organizations to make a guidance that would work for them as well. And you can even see now at this point in time that as public health measures are being loosened and people are going back to work and going back to schools, they're also going back to faith practices.
Mm-hmm.
This information has to get re-highlighted again.
Mm-hmm. Mm-hmm.
Okay, and I think this is the last one, just to emphasize again, our amplifying network through healthcare workers. We've done a lot of work to make sure that there's information for healthcare worker safety, safe workplace, clinical care guidance, and so on. So we've had a direct link to healthcare networks globally for this. I think that's it.
Yes. Yes, thank you so much, Melinda. This is fantastic, and again, thank you so much for your time. I know that we've participated as part of somewhat of the Amplify or the Amplifying networks, and that's how we learned about EPI-WIN. And we're happy to sort of have the level of information simplified enough that as we worked with grassroots, and when I used the grassroots term, right, I use that very much meaning folks who are direct service providers or directly engaged, in programs and projects around countries. And so one of the things that we've heard more and more of is a need for material in their own languages as they're beginning to see and hear of various myths, right, that are being created. How can they sort of retool messaging that kind of addresses that? And so I'm really appreciative that you shared a couple of things. One, not only where the information is, but there is, on the WHO website, right, EPI-WIN has its own space with all of that information, and then it's organized by category, right? So faith leaders or communities and so forth. But I think one of the things that you highlighted that I thought was really important is that the messaging is dated. I don't know if you've seen, but I have seen folks send me through WhatsApp messages that would say WHO said, and it's a myth. It's not the correct logo. It's not dated, right? But it's the creation of something, and it kind of looks like it might sound right. So I think one of the things that we have as a challenge, one is folks may or may not even know the WHO logo. To be able to even verify that that's really the World Health Organization. I think the other is how can grassroots organizations, as they're beginning to hear and see things on the ground that's spreading, bad news, fake news on the ground that's spreading, how can they connect up with WHO? Because one of the things we do recognize is, public structures or institutions is a primary way that WHO and all the UN agencies operate. And that is fantastic. However, when it comes to something like an Ebola, something like a COVID-19, it's got to get down to those roots, those grassroots connections. And so we've been providing, training and technical assistance to folks kind of sort of discern and kind of retool these things. But how do folks kind of feed up if they're not officially a part of that public infrastructure? Who's reporting up to you?
That's a good question. I think what we're really trying to do, and I think, or I hope we're doing a pretty good job at, is really expanding our partner network. WHO has a really pretty strong partnership with UNICEF and IFRC, and an increasing pool of partners that are working around community engagement, social mobilization, grassroots level. So I think through these partnerships, that should be easier to reach WHO than ever before. And I think that we're really, to avoid an infodemic, really trying to flood the market with, some solid science-based
Right.
information. I think we also have some guidance around how to combat an infodemic, how to look for information that just doesn't seem quite right, and to know to maybe stop, check your reference, check where it comes from, see if it's a reliable source, and to provide information about how to go about doing that. I think WHO is working on guidance for that, particularly for teenagers, so they can address misinformation and recognize it and not spread it, and be essentially an infodemic fighter.
I really like that idea, and I think that we had a great conversation with Rania about the community engagement piece, and sort of really getting to kind of laying out some structure around how we do that. And when we were part of that process as they were developing the minimum standards for community engagement. But I think now that we're in this place where communication is so critical, now that folks are locked at home, and all that they've got is the internet, right? If they do have the internet, and if not, it's what someone in the town next door said is happening. So I think one of the ways that we're definitely looking at engaging is potentially beginning to help to collect some of this information and being able to pass it on to you guys, because I think these are the pieces that can very easily get missed, right? It's not just sort of WHO sharing out, but it's also how's that feedback loop popping up in terms of what you're seeing and how you're tracking. And so anyway, so that's been really, really helpful. I'll say that I can tell you folks who've been involved in the slums areas, we're having huge challenges practicing social distancing or physical distancing and the like. And so coming up with real key strategies for how to address that, but also how to address the fear and the paranoia that ultimately erupts. And so from a communications perspective, I think, can you speak to addressing fear and paranoia? Because I think you hit it on the nail, which is, we're still learning about COVID-19, right? The science isn't all done. And so every day there might be something different. So then someone comes to you and says, well, I heard today, this is the new thing, right? I think I was sharing with you that I saw a president from one of the countries that we work with in the Caribbean literally share that, they're looking to another country that's purporting to have a miracle cure for COVID-19. That is the leader of an entire nation that is very challenged when it comes to its health system. And so, where do you go from there, right? When you've got the credible leader or leaders sharing information that has not been vetted from a science-based perspective. So how do we address the uncertainty and the fear and paranoia that comes along with this?
Yeah, I mean, I think the first thing to do is to acknowledge that, there are some things that are concerning. I mean, not to over reassure individuals, because nobody ever believes that, right? I mean, to really be open and honest about the fact that we are in scary times. There are a lot of unknowns that we we don't know yet, and learning, and just to keep reemphasizing the things that we do know. Protective measures, and really kind of how simple they are. And I think just in terms of a lot of misinformation that's being shared by people in authority, again, it's the idea of getting the right information through other trusted sources of information. Again, faith leaders, physician networks, going to the networks that are the individuals that people really typically historically really truly trust, the right information to those individuals. Also, we're doing a lot to reach out to radio as well, with just some basic scripts on protective measures and the latest science as well. So I think, again, trying to just flood the market, get the consistent messaging out through any number of different sources, and get that information to, again, the hands of community leaders and other trusted individuals and communities, so that you're hearing the same thing, the drumbeat of
Right.
truth, really.
Yeah, well, I thank you. I thank you once again. You know, I am definitely one of those that's already seen the impact, the positive impact of you know, EPI-WIN. And we're seeing folks really feel like they can take some ownership of information and have a level of discernment in knowing kind of what to do. We may not have all the answers, but this is what we know we can do. And I think that helps folks feel that, okay, wait a minute, I can't control everything, but this aspect I can address. So Melinda, this has been really, really great. I am so thankful that you made it to our meeting.
Thanks for having me.
For this conversation, and look forward to continued conversations, you know, as we see COVID-19, you know, as it's been crisscrossing around the world. But once again, Melinda, we appreciate you. Thank you for your time, and all the best to you. Thank you.
Thank you. Thanks.
Awesome.